Hello. I guess time to get real. Not a project update, but an update on something that's happening right now. There was an executive order that was just published, or signed, where it's called the Ending Crime and Disorder on America's Streets Act. What it does is it expands civil commitment and institutional treatment for individuals experiencing homelessness with mental illness or substance abuse disorders. It restricts funding for harm reduction programs or housing first initiatives. What it also does is instructs the Attorney General to seek reversal of judicial rulings and consent decrees that limit involuntary treatment. It also redirects funding to jurisdictions for forced hospitalization and outpatient treatment systems. So what all these things do together, what it does, it creates the policy where now it is federal policy to criminalize sleeping outside, being homeless, and it sets the groundwork to criminalize just being mentally ill. So why it's troubling beyond the obviousness of how troubling it is, it equates homelessness and mental illness with criminality. It incentivizes punishment instead of healthcare. It forced institutionalization has been proven to be counterproductive and harmful to those institutionalized. It divests from proven solutions like housing first models, which have been backed by decades of research. The order promotes sweeping data collection on unhoused individuals and those with mental health disabilities. It worsens homelessness by diverting resources away from proven solutions like affordable housing and supportive care. So, all of this. Okay. Just first off, my opinion is that everyone deserves healthcare and no one should be punished for living outside. And just go one step further. In my opinion, housing is healthcare. So healthcare, everyone deserves healthcare. I think housing is a human right. There should be housing for all. It's messed up. It's like truly just very messed up. I'm still kind of processing it because it just like really dropped just like an hour ago. So I'm really upset about this because, this is upsetting because truly there have been decades of proven research on models that work for like helping the problem of homelessness. And also when it comes to drug addiction and mental illness, forced institutionalization is not what gets the majority of people healthy. It's actually counterproductive. So what is helpful? Done a vlog about this already, but things like transitional and supportive housing, those are actually what get people healthy and get people help. Is transitional and supportive housing is essentially subsidized or like free housing that someone who is in crisis can stay at so that they can start to like restabilize their life, and then from that stabilization point go on to live a healthy life or get into a system of supportive healthcare. That like people know how to live and people know how to live for themselves, and people know how, unless like you actually do need to be in permanent assistive care, like that is a different thing. But not everyone on this, like who sleeps on the street, is that way. Like, so just for an example, just to illustrate how like people get to the point of like sleeping outside. What it does is, okay, so Illinois, their Congress, or Illinois, our Congress, my Congress, the Illinois Congress didn't pass funding for Chicagoland's public transit this year, which means that in the future there can be 40% service cuts and a possibility of an elimination of 50 plus bus routes and entire rail lines, like the Blue Line or the Red Line if you're from Chicago, or just a train station line if you're from another metropolitan city or aware of trains. So this impacts mental health care or healthcare in general, or just the people, like people's ability to live. Like you can end up sleeping on the street even if like you are fully mentally capable, but just like are caught in a situation that you're born into. It's like what your life is or whatever, because not everyone has access to a car. So some people are literally just like dependent on public transit. I mean, like public transit's great when it's like funded and like designed well, but when it's cut and you're dependent on it, you can't get places, and your reliability to transportation is like it's more difficult, which means that it's harder to maintain a job, get a job, any of things like that. It's harder to go to school. It's harder to do anything like that. So thing about that is, if you can't get a job, then you can't get healthcare. If you don't have healthcare and you don't have a job, then it's going to be more likely that you'll end up sleeping on the street. And none of that, again, is anyone's fault other than the system. So instead of funding programs that help people's quality of life and ability to live unassisted, what's happening right now is money is being spent on punitive programs that actually end up harming people. Whereas, again, there are decades of research where it is proven that housing first solutions actually are what help people, and community-based mental health care services are actually what help people. Forced institutionalization is not what helps people. It harms people. It increases stigma, which means that people don't go seek help, which means that their time before getting help, it's just longer, so their condition gets worse before they actually get into the system. And that's all just like a negative feedback loop that just makes it worse for people experiencing mental illness, people who are just like living in communities or whatever, the government itself, because they have to pay for all this kinds of stuff, and just like everyone involved. It's just harder. So the bill that was passed or signed today, it criminalizes all this stuff. It's punitive. It punishes people for living in a system that is broken. This bill punishes people that live in a system that is broken. I think it's worth saying again. This bill punishes people for living in a system that is broken, and that's no one's fault other than the system and the legislators that operate the system. So what can we do? Definitely vote. Definitely vote some new people in, I think. Vote for people who have advocated for healthcare. Fund services in your local area if you can give to nonprofits that are like housing supporting services. And just vote. Honestly, just vote. That's really the thing. Oh my God. So there's another thing that I wanted to talk about, like in this, because it kind of lays the groundwork for this, which is also like kind of terrifying, is criminalizing mental illness it opens the door for a further chilling of freedom of speech and other rights, because what can happen now is if you criticize the administration, they can just be like, well, you're crazy. And then now that it's illegal to be crazy, they'll just institutionalize you, or they'll jail you, or they'll execute you. So this could be like a weapon of the state against dissenters, and it just passed today. So that's cool. It's not cool, sorry. Just if you are unaware of humor, I do not think it's cool. I think it's horrible, and this is not the country that I want to live in, but this is where we are today. So I think this is a good little update and recap. Honestly, I don't know. I just don't even know. I'm despondent, but also kind of numb, because this it has just all been happening, kind of a nonstop onslaught since 2016. I'm really sad and frustrated. But you have to keep continuing on and trying, because a defeatist attitude only begets defeat. And the thing about that is I care, I just don't want to be, I just don't want to give up. So and just, there's just so many people, okay, now that I've lost my notes, I'll wrap this up. It doesn't have to be this way. We know better solutions, and the better solutions are actually cheaper. Kind of a more macro level. I love everyone who is impacted by this, because I feel you, and I feel for myself too. Selfishly, sorry. Oh my God. All right, I guess that's it. Had a great idea before this happened today, and some new things on the horizon in terms of events. Is this executive action? Is this kind of like an event? Yeah, I'm gonna stop rambling.